Today, I'm up in Liverpool, so come and meet Dr Yusra, and we're going to go and see her doing a non-surgical nose lift, a non-surgical rhinoplasty using Restylane Lyft. The patient's inside waiting, it's raining, we're going to get in there and get on with it. Come with me and watch. So Dr Yusra, you specialise in non-surgical rhinoplasties. How did you come to specialise in this?
It's actually quite a personal story, and people ask me this all the time, why did you choose noses? And I say, well, I didn't choose noses, noses chose me.
Okay.
But when I was training in maxillofacial surgery, I realised that I had a deviation to my nasal septum and I couldn't breathe out of one nostril. So as a senior health officer in the hospital, I had a surgical septoplasty, which unfortunately went wrong. And I ended up with a perforated septum that needed a repair and a second surgery 4 weeks later, using a graft to repair it, which widened my nose and genuinely made me feel very self-conscious about my nose for a very long time. So for me, after that, I became really passionate about noses and also passionate about getting it right, because I knew the impact it had on my patients, not just on their aesthetic appearance, but on their psychological well-being. And I find that this particular procedure, unlike other areas of the face, often holds a psychological burden. And therefore, the transformation is really a transformation from the outside and inside.
Wow, you must understand all the fears that they come in with when they are approaching you for treatment. How do you manage all those?
I think treating your patients as people, first and foremost, creating a safe space to talk about these things, because often when patients come to have treatment, they are still apologetic about it. There is still a stigma associated with having aesthetic treatments.
Do they feel they ought to be able to sort of just manage it and live with it?
Yes, unfortunately. I think they are impacted by the judgment around having aesthetic treatments. Again, coming from a background of dental surgery, I find this really striking because we don't see this when patients go to straighten their teeth. Whereas when it comes to straightening their nose, they feel embarrassed, they feel apologetic, and they're worried about being judged. And they're worried that it will change their face. At the same time, they often say to me, I hate my nose. I won't take photos. I won't take that front-facing job. I won't go on a date. I won't wear my hair up. So it impacts them every single day. And it's that really drives them into the clinic. So creating a safe space, making sure that they are judgment-free, there's no stigma, and they are unapologetic about seeking care. And we have a conversation about what it means for them, how it's impacted them, and what they want to achieve. And again, because of my background, because I've had surgery that went wrong, I really understand the fears and why it's so important to get this done right the first time.
There's a certain illusional quality to what you do.
Yeah.
Could you talk a little bit about that?
Yes, it's a very counterintuitive, because when you think of fillers, you think of volumization. And technically speaking, we are adding volume to the nose by adding a dermal filler.
Yeah.
The product is injected in such a way that we are very, very precise about the placement. And by placing it in key strategic areas of the nose, you can certainly create an illusion that the nose is smaller.
Yeah.
You can lift the tip of the nose, you can mask a dorsal hump, you can improve a deviation, you can help to anchor the nose so that when a patient is smiling, it no longer drops. And so you can really create transformational changes whilst maintaining a very defined nose, so that means without volumizing it. And that comes from correct product placement, correct technique, and correct product choice.
And I'm sure you have people who are thinking about a surgical rhinoplasty as well, and they want to understand the difference between a non-surgical and a surgical one. How do you go about explaining that to them?
So I tell them a surgical rhinoplasty is a reductive treatment where a patient will have cartilage removed, fat removed, bone removed from the nose. And this is not that. We are leaving the tissues as they are, but we are masking humps. And we are creating illusion. We are changing the way that the light reflects off the nose. Yeah. And certainly by repositioning the tip of the nose, you can physically make the nose shorter. Restylane Lyft is my product of choice. This filler is FDA approved, which means it's on license for use for treating the nose. The product is a very long-lasting product. It is fantastic for treatment of structural deficits, so where we're trying to emulate bone or recreate structure. So it's great for the nose where we want definition, we want projection.
And it'll be a good long-lasting result as well.
Yes, in fact, the data has shown that it lasts up to 24 months, which is fantastic for patients because it means that it's the gift that keeps on giving and patients don't have to keep coming back for routine top-up procedures.
Sure. And do patients come in with particular expectations around what you can and can't do non-surgically for a nose?
You know, the world of social media and filters can make our life a little bit difficult.
I bet.
And expectation management is a very important conversation to have with our patients. But at the same time, I think the majority of patients do have realistic expectations. They understand that there are limitations to what can be achieved without surgery. And often they will come with a specific outcome in mind, whether that is masking a dorsal hump or lifting the tip. And we can treat patients from all walks of life, a diverse range of skin colors, and all shapes and sizes of noses. Having said that, there are certain patients who may come that are not suitable for a non-surgical procedure, and we delicately navigate those conversations.
So Hina, what is it that's brought you here?
My nose. My nose has been an issue for quite a few years. I broke it quite a few years ago, and I'm really too terrified to go for elective surgery.
How long have you been thinking about it?
Actively getting it done, I'd say about the past 2 years.
And what is it that bothers you about your nose?
I have a very Roman nose, and I don't hate my nose, I just know it's deformed, and I know because it's broken, it isn't my true nose, and I just like to have remnants of what my nose would look like if it wasn't broken, and not feel so self-conscious about it.
And do you have a specific end goal in mind?
Just to not have this big hook.
Okay.
And I think my hook is the biggest issue, aside from I feel like it's wide and I would like it on face front to look less broad. And I know from the side, because of the illusion effect that you give, it looks smaller on the profile. I'd love to be able to allow people to look at me on the side. When I'm out and about, I try and face people front on because I'm very paranoid about people standing the way you are, because I know that's the first thing that their eye will hit.
Yeah. It's quite a simple procedure, but a very strategic procedure where we are using dermal filler, a hyaluronic acid gel, and we inject that into strategic parts of the nose to align the nose. And what we're doing is we're masking the hump. So we inject above the bump that she doesn't like, we inject below it, and we often also inject at the tip. And what that does is it creates the illusion of a slimmer nose by creating a highlight in the center of the nose, on the bridge of the nose. We reposition the tip, and by repositioning the tip, you are shortening the nose. So it is a play on light, and it is an illusion. Physically, I'm not making the nose smaller. It is a procedure where we're adding volume, but we're doing so in such a strategic way that actually the end result is the illusion of a smaller, straighter, and even shorter nose. I'm going to be using Restylane Lyft for this procedure, and the reason why is because Restylane Lyft is specifically formulated to give projection. It's a high G prime filler. It's also licensed for the nose, so it's got an FDA approval for the nose. Restylane is made by a company called Galderma and has a huge legacy of 27 years. There have been 65 million treatments performed worldwide. And what that means is we know that it has a very high safety profile, a great clinical record, and a very low risk profile. Now, this particular product is very different to other fillers in that it is specifically designed for areas of structural deficit. So particularly great for areas that we need to give projection to, we need to lift, we want definition, we want precision without volumizing. And that's why Restylane Lyft is really a great product for the nose.
Terrific, so it's going to give a good strong result and not kind of spread off where you don't want it to.
Yes. The other thing about Restylane Lyft is the longevity of the product.
Sure.
So one of the things that patients often ask me is, how long will this last? You're busy, and the last thing you want to do is keep coming back to have a treatment. And unlike a surgical rhinoplasty, a non-surgical rhinoplasty is not permanent and does require maintenance. But the great thing about Restylane Lyft in particular is it's a product that lasts up to 24 months. And the nose is a really great area to inject, not just because of the aesthetic transformation, the emotional transformation, but also we know that the filler lasts there a long time. And I have patients who come back to me years later and the results still last. So it's the gift that keeps on giving. One, two, three, sharp scratch. We're going right down onto the bone and I aspirate. So I'm pulling back to make sure I'm not in a vessel, and I continue to put a lot of pressure. And the reason why I put pressure is I'm molding the product and I want the product to go exactly where I am pinching. And because this product has got local anesthetic in it, you should really feel comfortable.
I feel really comfortable. Sorry.
What do you reckon?
Oh.
Congratulations.
I don't know who that is.
Look at the side. If you use the second mirror to...
What?
Yeah.
What?
It is so beautiful.
Are you joking?
That's right, yeah. And look how the tip has come up.
That is actually, that's not my face. That is beautiful.
It really suits you and it's very natural looking. No one will know.
No one will know.
And we haven't created that avatar nose that you want.
I'm shaking.
Aww.
I actually can't get over this. How did you do that? This is what I would have expected from having a nose job. This is what I would have expected, because when I get surgery, I don't want to change my nose. I just want to improve my actual nose, and I feel like that's what you've done, is you've improved my actual face as opposed to taking away from my face.
So Yusra, this is the most fantastic result. From a technical point of view, what have you done?
So we have completed a non-surgical rhinoplasty and also chin augmentation, and this is a typical profile balancing procedure. I've injected at the root of the nose, called the radix, and also at the tip of the nose and underneath the nose. And in these 3 injection points, we have masked the dorsal hump, so the bump is now no longer visible. We've lifted the tip, and in doing so, we have shortened the appearance of the nose. We've also elevated the tip so it doesn't drop when you smile, and we've improved the deviation, so you no longer see a stark contrast or a stark deviation.
Because what it looks like from here is it's straighter, it's lifted, and it's somehow narrower. And safe to say you're quite happy.
I'm so happy, yeah. I'm surprised that you said about the nose dipping when you smile, because that was another worry about me, because I got called a witch for having a sinking nose when I smile.
Yeah.
So
It's just the muscles.
Smile. Yeah. I used to try not to smile as wide as I probably am now.
Yeah. And now you can smile without worry.
I can smile without worry, yeah.
So that's the beauty really of this procedure, is it very much respects how you look, maintains how you look. It's a very natural end result. And we've lifted the tip, we've made the nose smaller, it won't move as much when you smile, and hopefully that will help to improve your confidence. And we've also treated the chin, and by bringing the chin out, we have balanced the profile, which means that the nose looks smaller and definitely more harmonized with the rest of the face.
And people often wonder how much of a difference a small, quick procedure can make. I mean, this is one that's really quite transformative, isn't it? From an emotional point of view as well as physical.
Yeah. Well, one of our taglines is empowering transformations, and I'm definitely a big believer that the treatments that we perform on the outside have a profound and positive impact on the inside. As you said, for you, it's made a huge difference psychologically. Thank you for coming.
Thank you for doing it. Thank you.